Overburdened, overstretched, overwhelmed. Accident and emergency departments are often the pinch point in care provision for today's NHS. But in Staffordshire, Burton Hospital's NHS Foundation Trust is taking steps to ease the strain with the creation of a new Acute Assessment Centre. It's just one of a series of innovations designed to improve patient pathways. Piers Hopkirk has taken a look behind the scenes.
Accident and emergency. It's a notorious NHS bottleneck, putting pressure on precious resources.
But here in Burton, in Staffordshire, they're innovating to ease the strain.
With control of this heart rate, but for now, try introducing them into block and see where you get to.
The Burton Hospital's NHS Foundation Trust has created a brand new Acute Assessment Centre for the urgent assessment, observation, diagnosis and treatment of non-elective patients.
Oh, good afternoon.
Hello, my doctor sent me. Okay, let her know.
Vivian Huckabee has high potassium levels in her blood. Rather than going to A&E, her GP has sent her for an appointment here.
Making the new unit, what we've managed to do is get the right patient in to the right area, seeing the right doctor at the best time for them.
The centre also takes speciality referrals from the emergency department, with on-call doctors to assess and treat patients. A new hub for better patient pathways.
The idea of having this system is really to give patients this opportunity and us this opportunity to do something. A, reduce the waiting time. B, come up to some decision making for patients in a timely fashion.
They feel more confident and more kept in touch with the situation. The patient journey has improved, and that's the feedback we're getting from the general public at this present time.
And your doctor was sending you up because he was worried about your cough, wasn't he?
Yes, yes.
The centre also has a team of in-house GPs.
We have the advantage of we deal with ambulatory care in the community, we're experienced with that, we know what can happen, and we can help develop that so that people don't stay in hospital unnecessarily and can get the best treatment. We're talking about a cost-effective, patient-friendly experience, really, is what we're trying to maximise.
Kevin Pierce, up this way.
At the Trust's Samuel Johnson Hospital in Lichfield, a minor injuries unit also helps ease the burden on A&E.
Last night I couldn't put any weight on my heel at all.
Electrician Kevin Pierce fell from a ladder. He's come here to be assessed.
I think it's excellent myself. You can come along to a place like this, get dealt with there and then, less time off work.
New patient pathways are also helping to cement Burton's reputation for excellence in orthopaedic surgery. A new multidisciplinary approach is having a major impact.
We have developed a special program called as the Enhanced Recovery Program, which is a program which allows patients to be mobilized very quickly after their operation. And we have managed to reduce hospital stay by at least a couple of days.
The approach sees anaesthetists and surgeons working closely to minimise recovery times. Physiotherapists are also involved, teaching exercises ahead of surgery, so patients recover faster and leave hospital quicker.
We get them motivated, we encourage them, we get them to comply with the exercises and the techniques that we're going to teach them so that they instinctively remember what to do when they come into hospital, and that helps them to get going quicker.
So what difference does it make to the patient experience?
Oh, a fantastic difference, fantastic difference. Very often my wife will say, "What are you doing upstairs?" And I say, "I'm doing the exercises," and it really does help.
And how are you feeling today?
You're up the same day and you're moving, and it's much better.
So with its dedicated professionals creating new pathways for care, Burton FT is helping to create a smoother journey for patients on the road to recovery.